Hey, I'm Hannah, and I'm a doctor with type 1 diabetes. And today we're going to talk about type 1 diabetes and IBS. If you don't know what IBS means, it stands for Irritable Bowel Syndrome, and it is very common and correlated with type 1 diabetes. Now, what is interesting in my experience working as a physician is that a lot of people don't know what healthy gut habits are or what healthy gut function looks like. And what's interesting is that it's not uncommon for people to come to the practice and say, oh, I have 2 bowel movements a week, but it's been that way my whole life, and not knowing that it's more ideal for someone to have a bowel movement every single day, or for someone to say that I always have loose stools or I frequently have loose stools, and that's just how I've always been, so I didn't know it was abnormal. A lot of families don't talk about these things and bowel movements and gut function because it can be something that's hard to talk about, especially in some cultures, family norms. And so it goes undiscussed, meaning that people don't learn what's healthy and normal. And so later on in life, they find that they've been having challenges with their gut health and they weren't aware of it. So, that being said, IBS, irritable bowel syndrome, is a diagnosis of exclusion, what we call in medicine. A diagnosis of exclusion basically means that you have a constellation of symptoms, and we've ruled out the most common causes of those symptoms. So, we don't know what's causing it, and we will call it this disease, irritable bowel syndrome. It doesn't necessarily tell us why, it just describes the symptoms at their frequency. IBS is diagnosed through the Rome 4 criteria, which really looks at the frequency and severity of symptoms. So, the symptoms that we look at to diagnose IBS are recurrent abdominal pain at least 1 day per week for the last 3 months, and the pain associated with three different things. One would be improvement or worsening with bowel movements. Two would be associated with a change in stool frequency, constipation or diarrhea. And three would be associated with a change in stool character. So that would be the looser stools or the pebble stools. Overall, these symptoms need to be persistent for 6 months in order to meet the diagnosis criteria. So recurrent abdominal pain, at least 1 day every week for 3 months consistently, overall symptoms for 6 months, and the abdominal pain used to be related to a change in stool character, a change in stool frequency, or pain related to bowel movements, improving or worsening around bowel movement. A lot of people fall into this category and haven't talked to their physician about it. I think it's important, especially since there's a higher prevalence of IBS and people with type 1 diabetes, that it's something that we talk about. Now, what's interesting is that, again, IBS is only diagnosed if we've ruled out other common causes of GI symptoms. And there are other GI diagnoses like Crohn's disease and celiac disease that are also more common in people with type 1 diabetes. Celiac disease and Crohn's disease are other forms of autoimmune disease like type 1 diabetes that affect the gut. And so anytime we have recurrent symptoms, especially with type 1 diabetes, it's so important to talk to our doctor about these so we can make sure that we're not missing any clues that our body is giving us that there might be something else going on that needs more aggressive or more specific treatment. Now, once people have been diagnosed with IBS and we've ruled out those other common causes, there are things that we can do based on the studies that we have to actually help improve the symptoms of IBS. When we look in the world of nutrition, they very well studied nutrition plan that's recommended to be followed just temporarily to help improve digestion is something called a low FODMAP diet. FODMAP stands for fermentable oligosaccharides, disaccharides, and monosaccharides, and polyols. And FODMAPs are basically certain types of starches that are prevalent in different fruits and vegetables. So a low FODMAP diet typically includes cutting out the majority of these types of starches that show up in certain fruits and vegetables. So a low FODMAP diet handout will include a list of vegetables that are high in FODMAPs, a list of fruits that are high in FODMAPs, and recommend eating less of them. This has shown improvement clinically with symptoms of pain, stool character, and stool frequency for people and can improve quality of life. What's great about these FODMAP studies is it does not need to be a lifelong nutrition plan. In fact, I don't think it's a healthy long-term approach because it does cut out so many healthy fruits and vegetables. However, when used temporarily over the course of 3 months, maximum maybe 6 months, in my clinical opinion, what we see is that people are able to decrease their symptoms when we adjust the food that we're bringing into our body, our microbiome can make shifts over time. And ultimately, people do find that they tolerate these FODMAP heavy foods better when they reintroduce them after a period of reintroduction, which is really amazing that nutrition can be part of a long-term symptom improvement, even when it's not followed long-term. Another great study or a series of amazing studies on IBS support is the use of probiotics. There's an abundance of literature about different types of probiotics and gut health and gut symptoms out there. But when we look at irritable bowel syndrome, what we see when we look at different meta analyses that are available is that the bigger variety of bacterial strains tends to be a positive approach at reducing symptoms. I've got a lot of studies on specific groups of bacteria or specific strains of bacteria, but by and large, from larger studies that look at a lot of smaller studies, what we see is that when someone with IBS supplements a large variety, not just of strains of bacteria, but families, different kind of categories of bacteria through probiotics, then they are more likely to have an improvement of symptoms. And prior to my work here, I worked at a clinic that did research on IBS specifically, not for type 1 diabetes, but in general, IBS. We found a lot of benefit in probiotic use for our patients with IBS and just profound symptom reduction. I had many patients tell me that they had GI symptoms since they could remember as a kid and had significant changes just through using probiotics that helps reduce their day-to-day symptoms. So that is something that we are seeing, which is really encouraging. So low FODMAP diet and probiotics are probably the two mainstays of IBS lifestyle medicine that we recommend, that we see really positive results in. And again, these are things you would absolutely want to talk to a physician about, especially changing nutrition plan with type 1 diabetes that can impact insulin. But know that if you're suffering with GI symptoms, there may be more support out there for you. And the best first step is usually just to talk to your doctor, even if it makes you a bit uncomfortable, because these things are important to overall health. And as someone with type 1 diabetes, you may have already learned that if you are going through a period of GI upset, it can absolutely impact our blood sugars. When we're having loose stools or lots of diarrhea, we are more able to get dehydrated, which can make it harder to keep our blood sugar lower or make our blood sugar go up. If we're feeling nauseated, that can make it harder to eat. And certainly we want to be able to do that when our blood sugars are going low. There's also a huge correlation between gut health in general, looking at the intestinal lining and something called increased intestinal permeability, which is kind of spaces in the intestinal lining where the integrity of the lining becomes more porous. And that is correlated with an increase in autoimmune disease. So we know there's a huge autoimmune disease and gut health connection. We're learning more and more about it with research, but we've got enough data now to say confidently that there is a connection. And so when we look at how do we optimize our health as a whole and how we feel in quality of life day to day as a whole, gut health is important, just like blood sugar balancing is. And I don't see it talked about in type 1 communities maybe as often as it probably comes up for people. So I hope this is helpful. Please let me know if you have any general questions. And if you're interested, I have a type 1 diabetes mindset reset course coming out in the next couple of weeks. This is a course that is designed to help people really look at their relationship with type 1 diabetes in a way that is not judgmental and figure out how to shift beliefs in order to create a more empowering relationship with type 1 diabetes. It's the process and tools that I use to get to a place where I feel good about living with type 1 diabetes. And I put together in a course to share with you. So that will be available here in the next couple of weeks. And if you want to sign up for the wait list, you'll be one of the first to know. And that link is in the description. Thanks for sticking to the end. And I hope to see you next time.